Welcome to this week's health topic on asthma. We'll review what it is, how it affects you, and how you can better manage it. Asthma is a chronic lung disease that inflames and narrows the airways in our lungs. It causes recurring periods of wheezing, chest tightness, shortness of breath, and coughing. Asthma affects people of all ages, but mostly it starts during childhood. In the United States, more than 25 million people are known to have asthma. About 7 million of these people are children. Asthma affects the airways that carry air into and out of our lungs, causing them to get inflamed. This inflammation causes them to narrow and can make it difficult to breathe. When the airways react to the inflammation, their cells may also produce more mucus than usual. Mucus is a sticky, thick fluid that can further narrow the airways. This combination of narrowed airways and excessive mucus can result in severe asthma symptoms or an asthma attack. Treating the symptoms when they first occur is very important. This can prevent them from getting worse and developing into a severe asthma attack, which may require emergency care and can be fatal. Although there is no cure for asthma, there are many ways to manage it. One way to manage it is to use a peak flow meter, which is a handheld device that measures how well air is moving out of your lungs. Keeping track of your peak flow is an important part of managing your asthma symptoms and preventing future asthma attacks. The meter measures what is called a peak expiratory flow, or your PEF. Your PEF is one way to know if your symptoms of asthma are in control or worsening. You should determine your personal best PEF. This is the highest peak flow number you can achieve over a 2 or 3 week period of time when asthma is under good control. Knowing your personal PEF is important because it is the standard that you will compare all future flow meter measurements to. People with asthma should take peak flow readings each morning to identify your PEF. If your PEF drops below 80% of your personal best, you may be heading towards a severe asthma attack. Gauge your asthma severity by breaking readings down into 3 zones. You're in the green zone if your PEF is within 80% to 100% of your personal best. It's a sign that all is likely well. If your PEF is between 50 and 80% of your personal best, you're in the yellow zone, and it's time for decisions. Your airways are narrowing and may require additional treatment. Make a plan on how to react to yellow zone readings. If your PEF is below 50% of your personal best, you're in the red zone and it's a medical alert. Immediate decisions and actions need to be taken. Severe airway narrowing may be occurring. It's time to take your rescue medication right away. Contact your healthcare provider immediately and follow the plan that they have given you for red zone readings. Can what you eat affect asthma? Although research is far from definitive, there are some hints that this might be true. Although individual reactions to foods can vary a great deal, there are some foods that can help and hurt your asthma. Here is a list of some of the best and worst foods regarding their impact on asthma. Some of the best foods are apples. A British study found that people who report eating 2 to 5 apples per week had a 32% lower risk of asthma than people who ate less. There is speculation that a compound known as flavonoids found in apples may be responsible. One type of flavonoid has been shown to open up airways. Although you can't elope with a cantaloupe, you can get a ton of vitamin C from them. Vitamin C is an important antioxidant that may ward off lung damage by fighting free radicals. One study of preschool children found that those with the highest intake of vitamin C were less likely to suffer from asthma than those with a lower intake. Although vitamin C can be found in most fruits and vegetables, they are super abundant in cantaloupe, as well as citrus fruits like oranges and grapefruits, and in kiwi, broccoli, Brussels sprouts, and tomatoes. Carrots. Carrots are famous for containing beta-carotene, another antioxidant. Preliminary studies suggest that beta-carotene, which is converted to vitamin A in the body, may reduce the incidence of exercise-induced asthma. Avocados. Avocados contain an important antioxidant called glutathione. Glutathione has been called the mother of antioxidants for its health-promoting properties. In addition to avocados, other glutathione-rich foods include broccoli, cauliflower, cabbage, Brussels sprouts, and garlic. Some of the worst foods are salt. The data on whether salt exasperates asthma is mixed, but an association does make sense. The hallmark feature of asthma is inflammation and tightening of the airways. Salt can contribute to inflammation by causing fluid retention. Reducing salt intake is good for a lot of other reasons as well. Fast foods. In addition to being loaded with salt, fast foods may be bad for your lungs. An international study of nearly 2 million children observed the link between fast food consumption and asthma risk, according to a British medical journal. 3 or more servings of fast food per week were found to increase the risk of severe asthma by 39% in teens and 27% in children. Researchers speculate that this is because of the high level of saturated and trans fats found in these fast foods, which can weaken the immune system. If you have asthma, maintaining good day-to-day asthma control is the best way to keep symptoms at bay and prevent asthma attacks. Having a written plan makes it easier for you to measure how you're doing. The plan should include the following. Tracking your asthma symptoms. Record when your symptoms interfere with your daily activities, such as work, exercise, or sleep. Also track how often you have to use your quick-acting inhaler. Use a peak flow meter to track your asthma day to day. This simple handheld device tests how well your lungs are working. Measurements that are lower than usual indicate that your lungs aren't working as well as they should be. This is often the first sign that asthma is getting worse. Adjust your medications. Asthma medications usually include a long-term control medication and a quick-acting medication. Make sure you understand which medication to use when, how to use them, and what to expect. Recognize and treat an asthma attack. Track your symptoms daily and adjust treatment accordingly to improve asthma control and reduce the risk of having an asthma attack. Know when to seek emergency care. Some asthma attacks can't be managed at home. Learn how to recognize the signs of rapidly worsening asthma. If you use a peak flow meter, unusually low readings are generally a sign that your asthma is becoming worse and may become an emergency. Avoid asthma triggers. These vary from person to person and may be caused by exercise, cold air, pollen, dust mites, mold, pet dander, respiratory infections, and smoke.